is Helene Rusi, and I am a licensed massage therapist in the state of Ohio. I've been licensed for almost 20 years and have worked on tens of thousands of people during that time. And I've developed over the years some techniques for having my clients work on themselves, teaching them things that they can do for themselves, because my eventual goal for anyone is for them to be able to not see me anymore. So these are the charts that illustrate some of the most common trigger points that I work on. And the way the chart works is that if you look at the chart, you'll see that there are X's, and they're surrounded by a colored wash. And the X's show the most common location of the trigger points, and then the colored areas show the common referral areas or pain referrals. So the muscle I'm going to be working on today is actually seen on this part of the chart. You can see that there is a trigger point in the vastus lateralis, which is one of the quadriceps, which causes a referred pain pattern directly over the knee. So that's the trigger point that I'm going to show you how to work on yourself today. So what we're going to do in order to treat the trigger points in the quadriceps here is to use the bone of the forearm or the elbow to put pressure on the trigger points. The first thing to remember is that you're going to want to keep your foot, your lower leg, your thigh as relaxed as possible, and just use your body weight on your elbow in order to find the trigger points. So I start about the middle of my thigh and just lean using my forearm on my thigh, and if I rock back and forth a little bit, sometimes I can find where the trigger point is, and I would put 30 or 40 seconds of pressure on that, and then move a little closer to the knee. And again, just using gravity and my body weight on the trigger points. Usually it'll be sore if I find a trigger point, and I may also feel a little bit of a lump there. The muscle usually gets tighter the closer you get to the knee. You might find it a little bit harder to stay on the trigger point. The muscle will move, but you can gently adjust your direction of your force in order to stay on the trigger point. So I just work all the way down, using my elbow, the point of my elbow, or the edge of my forearm to work on those trigger points. And again, I would spend longer on each of these trigger points, maybe 20, 30, 40 seconds at a time. So one of the really important parts of a successful trigger point treatment is the stretching that occurs after the trigger point therapy. If you think of the trigger point as a knot in a rope, and the muscle is the rope, the pressure can untie the knot, but you really have to stretch the muscle afterwards in order to show it that it has additional length to work with. So there are a lot of ways to stretch the quadriceps. The safest way is to do it in a chair and simply drop the leg that you have treated off the edge of the chair and grasping the ankle, pulling the heel back up towards the back of the thigh. And if you're not very flexible, you can even grab the bottom of the pant leg in order to get that stretch.